Epidemiology has to do with diseases or health processes in populations. So as soon as you have a population of some sort, it can be a class of students, it can be workers in a factory, it can be people in a shopping mall, it can be patients in a hospital. As soon as you have a population and you look at their disease experience, it can be whether they have the flu, whether they're depressed, whether they had cancer, or suicide, whatever, you're into the domain of epidemiology.
Explaining epidemiology is always challenging because people think it has something to do with the skin. I like to link in that epidemiology has to do with epidemics or diseases, and it's the study of the diseases at the population level. So you're not interested in the individual evolution of a disease in one single person, but in how diseases affect society as a whole. What is the burden of disease? What is the average effect of treatment? Not so much what happens with one person. That becomes a very clinical judgment, and it's more of an art than a science to treat a person. But at the population level, we can understand how the decisions we're making about healthcare impact everybody. And that's really what an epidemiologist does.
If I were to define epidemiology to someone who didn't know what it was, I would probably say that what it's doing is looking at differences between groups of people to try to help you understand disease. So looking at things like, does a group of people who smoke more, are they more likely to get lung cancer? Or do groups of people who take vitamin C, are they less likely to get colds? Whatever question you're interested in. But I guess the key is that you're looking at groups of people to try to help you understand health a little bit better.